Hello. Our debate is going to be on neurodivergent affirming practices. This is class 619, and our group members are Kamala Godwin, Shay Gordon, Megan Cormier, and Cole Fornes. This is a little group member introduction for y'all. My name is Megan Cormier. I live in South Louisiana, and I have worked as an RBT for the past 4 years in clinical and school settings with clients from the ages of 3 to 17 with developmental delays. I currently am in my last semester at Ball State for a master's in special education, and I hope to sit for the BCBA exam soon after graduation and stay working at the clinic I currently work at.
Hello, my name is Camila Godwin. I currently live in Savannah, Georgia, but I'm originally from Westchester County, New York. I have previously worked in a clinic as an RBT, and I now currently work as a behavior clinician, providing behavior support services to adults with ASD or IDD, which is intellectual developmental disabilities. These adults also have a Medicaid waiver with my state. I plan to pursue my BCBA certification after graduating from Ball State University, and I would like to continue to work with both children and adults with ASD.
My name is Cole Fornes. I live in Raleigh, North Carolina, but was born and raised in Charlotte. I have been in the field for around 2.5 years as an RBT and have been pursuing my master's in ABA as well as my fieldwork hours for a little over a year and a half. Throughout my time in ABA, I've worked with kids with ASD and ODD, which is oppositional defiance disorder, as young as 2 upwards to 17 years old. I provided services primarily in the clinical setting of private practice, but have also provided services in schools, homes, and various locations in the community.
Hi, my name is Ladracia Shay Gordon. I am originally from Orlando, Florida, but I currently reside in Kansas City, Missouri. I bring over 15 years of experience in mental and behavioral health, working with diverse populations across a range of settings. My background includes supporting incarcerated individuals undergoing detoxification and deemed incompetent to stand trial, as well as providing clinical and residential care for individuals with intellectual and developmental disabilities. Throughout my career, I have held several leadership positions in specialized roles, including program specialist, program manager, program director, and DMH investigator for abuse and neglect. In the past, I have served as an FDLE certified correctional officer with the state of Florida, which has strengthened my understanding of the correctional system and reinforced my commitment to ethical care and rehabilitation. I hold a Juris Master's in Compliance Law, and I'm on track to complete my doctorates in Healthcare Administration by the end of 2025. Additionally, I plan to complete my postgraduate BCBA certificate by the end of 2026.
And here we're going to go over just our roles for the debate. I, Megan Cormier, will do the introduction, the conclusion, the core principles, and the counter arguments from the cons.
I will be covering personal biases and the counter argument from the.
I will be covering the ethical considerations and the cons.
I will be covering Q&A and the pros.
Okay, and here is our introduction to neurodiversity. The neurodiversity concepts views neurological differences like autism, ADHD, and dyslexia as natural variations in the human brain. These are not problems to be fixed, but part of normal human diversity. Some goals of neurodiversity affirming practices are to promote respect, understanding, and inclusion for all individuals, and focuses on accepting and supporting people rather than trying to normalize them. Some potential benefits of neurodiversity affirming practices is to build stronger therapeutic relationships between clients and professionals, help reduce stigma and discrimination, and empowers individuals by recognizing their strengths and encouraging self advocacy and autonomy. Some ongoing challenges we're going to go over are some still see neurological differences as deficits that need to be fixed. School systems often fail to fully meet the needs of neurodivergent students, and the neurodiversity movement may not reflect all cultural perspectives. And the purpose of our debate is to explore both the benefits and limitations of neurodiversity affirming practices and to discuss how these practices can be applied effectively and inclusively in the real world.
3 pros focusing on the neurodivergent affirming practices. Neurodiversity affirming practices improve the therapeutic alliance between the client and the service provider. The use of neurodiversity affirming practices can reduce the stigma and discrimination of diagnosis of ASD felt by stakeholders. Neurodiversity affirming practices focus on supporting the long term well being of the individuals receiving the services. Number 1, improving the therapeutic alliance between the client and the service provider. Building trust and mutual respect by recognizing the client's unique strengths and experiences. Encouraging open communication, helping clients feel heard and understood. Promotes a collaboration relationship where goals are set with the clients and not for them. Help reduce power imbalance, making therapy feel more supportive and person-centered. Leading leads to a greater client engagement and cooperation during sessions. Number 2, reducing stigma and discrimination of ADS diagnosis, shifting the focus from fixing behaviors to understanding differences, promoting the idea that neurological diversity is normal and valuable, encouraging positive language that avoids labeling the individual as broken or a defect, help educate families, peers, and communities to see that neurodivergent individuals with empathy and respect, reduce shames of isolation that people with ASD and their families may feel. 3, supporting the long-term well-being of the individual, focusing on self-acceptance and building confidence rather than comfortability. Come from immunity, encouraging skills from independence, self-advocation, and self-regulation, promoting mental health and emotional resilience through accepting and support, prioritizing quality of life and personal fulfillment, not just symptoms reduction, building a foundation for long life growth and inclusion in school, work, and community settings.
So I will be discussing 3 points that are against the neurodivergent affirming movement. So although neurodiversity affirming practices promote acceptance, the neurodiversity paradigm is not always culturally inclusive, and some cultural communities may have different views and expectations about disability behavior and support. While neurodiversity affirming language aims to be respectful, terminology can still lead to misunderstanding or discrimination, as some people may misuse labels or continue to treat neurodivergent individuals unfairly. Even with neurodiversity affirming efforts, many educational systems still struggle to meet the unique learning needs of neurodivergent students, which results in challenges with communication, social expectation, and classroom structure. We'll go over each of these points in the subsequent slides. So point number 1, lack of cultural inclusivity. Some cultures may see disability through a medical, spiritual, or family-based lens and not as a natural variation. For example, there are some Western African cultures or tribes that consider disabilities like autism to mean that the individual has a closer connection to their ancestors. And so this is actually viewed as a positive standpoint and not necessarily stigmatized or negative as autism is sometimes viewed in other cultures and parts of the world. Cultural expectations about communication, behavior, or independence can clash with neurodiversity affirming views. A lot of times, for example, we'll hear about how in certain cultures, um, eye contact is frowned upon or not viewed as something that is done in that culture. Whereas a lot of times in um, ABA therapy, we would promote students or clients having eye contact with the people that they're speaking with. So that would kind of clash with those cultures that view eye contact as disrespectful or rude. Families from diverse backgrounds may feel misunderstood or excluded if their cultural perspectives aren't acknowledged. So that's very similar to my previous point. If you're trying to promote an action that is not in alignment with a cultural practice of that person's family, that may make the person or the family feel misunderstood or excluded. Practitioners may need extra training in cultural responsiveness to apply neurodiversity principles effectively. So point two, the misuse or misunderstanding of terminology. So even though neurodiversity affirming language aims to be respectful, terms can be misunderstood or misapplied. So examples, you have neurodivergent or neurotypical. Those labels can sometimes create new divisions instead of promoting unity. Some people may use the language without understanding the deeper values behind it. Similarly, you have distinctions between higher functioning individuals and lower functioning individuals. Those type of labels also lead to um, a us versus them dynamic where people who are labeled one or the other feel like they're not part of the same community. However, both people in the high functioning and lower functioning are still neurodiverse. Misused terms may still lead to stigma or discrimination, especially in the workplace or schools unfamiliar with the concept. Inconsistent terminology can cause confusion among professionals, families, and individuals seeking support. So the last point of the cons argument is challenges within the educational system. So some schools lack resources, training, and staff to fully support to fully support neurodivergent learners. Typically in those type of environments, you would like to see what we call the PEACE model. And so the P stands for providing curricula that celebrates diversity. E is embracing differences and maximizing strengths. A is accommodating sensory needs. The C is collaborating with students on discipline, and E is for enhancing executive functioning. Traditional classrooms may rely heavily on rigid structures that don't allow for flexibility for different learning styles. So that flexibility for different learning styles is associated with the E, which is embracing differences and maximizing strength, and as well as the A, which is for accommodating sensory needs. Communication and social expectations can be difficult for students whose needs aren't properly accommodated. So again, that goes back to the A, accommodating sensory needs, and also again, embracing differences and maximizing strengths. Teachers may feel unprepared to implement neurodiversity affirming practices consistently. So that means that they don't have the P, which is providing that curriculum that celebrates the diversity. And finally, without systemic change, students may still face barriers to inclusion, participation, and academic success. And that's all related to each of the parts of the PEACE process here.
All right. So from the pros side, our counter argument to the con side. First up, while masking can appear to make the individual feel more comfortable in their environment or quote unquote more typical, um, it often, uh, I say typical because the individual is likely to face less social ostracization. In reality, it can make the individual feel physically uncomfortable. It can also lead to general or physical or mental harm and can lead to a low self-esteem, self-alienation, and internalized stress. Our second point was that under the BCBA Ethics Code, we have a duty to put the client first. This is in regards to the con side that it isn't culturally responsive in all cases. Um, but we have the duty to honor what the client wants out of the services we provide. If they do not subscribe to the neurodiversity affirming movement, i.e., other stakeholders, then goals can be focused on alleviating symptoms of ASD. But pressure from stakeholders of the case should never lead to unethical service delivery in any case. And then the third point is that the use of neurodiversity affirming practices is within a movement towards educating individuals on the differences between those with ASD and those who do not have ASD, as well as humanizing people who are neurodiverse. While cultures do have different norms, morals, and values, we are all humans at the end of the day and should be treated with respect and compassion, especially if you are seeking therapeutic services.
Okay, and now I'm going to go over the cons for the counter arguments from the cons. While affirming practices can strengthen rapport, some critics argue that focusing too much on the acceptance might reduce attention to skill acquisition or behavior change. Need for independence. An example of this would be a therapist is teaching communication goals to stay affirming. The child builds trust by continuously having outbursts because they can't express needs. There's a risk that reducing the focus on diagnosis specific support might lead to underestimating or overlooking individuals' genuine needs for specialized services or accommodations. An example of this I have as I personally go to school with a client, and she is in a regular ed classroom, and the school is focusing more on her acceptance, but isn't really focusing on her learning and how she should be in a SPED class. And there's been discussions between her parents and the school about how they don't want her to leave the school, but the school doesn't provide that special education class uh, that she would need to be in. So they're kind of in a misunderstanding at the moment, trying to decide on what they should do, like what the parents want to do. And then our last one is some may argue that emphasizing long-term acceptance could delay necessary early interventions that build critical communication or adaptive skills. My example for this one is a parent may postpone therapy to avoid being non-affirming. Later on, this may result in more intensive help to build communication skills. And that is our counter arguments from the cons. Next up is going to be our ethical consideration.
So in reviewing the BACB ethic codes for behavior analysts, we found several codes that are related to the pro side of the neurodiversity affirming movement. And so some of these codes I have recognized. The first category is respect for client dignity, autonomy, and diversity. And so the codes that fall into that category are being truthful, conforming with legal professional requirements versus, which I'm sorry, includes local and state laws and requirements. Next, you have practicing within the scope of competence, which means only providing services that you're skilled and trained to provide. Cultural responsiveness and diversity, non-discrimination, non-harassment, and awareness of personal biases and challenges. So all these codes have to deal with maintaining the client's respect and dignity and autonomy, celebrating cultural diversity as well as neurological diversity, respecting divergent communication such as the use of AAC devices, verbal stimming, and scripting, and finally, creating environments that are inclusive of all abilities and that are free from hostility, harassment, and discrimination. So then when we think about a collaborative and person-centered practice, codes 2.01, which is providing effective treatment, 2.09, involving the clients and stakeholders, 2.11, obtaining informed consent, 2.14, selecting, designing, and implementing behavior change intervention, 2.19, addressing conditions that interfere with service delivery. So these codes have to deal with improving autonomy and quality of life, collaborating with the actual client, even if they're a child, about their goals for services and goals for their lives, making sure that the client and stakeholders understand the goals of service and how it affects current behavior, creating goals that are socially significant to the client, as well as stakeholders, which include their family, and that are not based on neurotypical ideals. Creating goals that don't make the client uncomfortable, such as forced eye contact, discouraging stimming, and other things that, again, make the client uncomfortable. Creating environments that are conducive to the client's needs, such as low lighting, reduced noise, and sensory objects at hand. And then code 3.01, responsibility to clients. That means honoring the client's identity, their personality, their desires, and their needs, while also supporting their autonomy, their safety, and their comfort. There are also some codes that I would say not necessarily against the neurodiversity affirming movement, but kind of conflict with it. And so when you look at codes 1.07, which is cultural responsiveness and diversity, 2.01, providing effective treatment, 2.09, involving clients and stakeholders, 2.11, obtaining informed consent, 2.14, selecting, designing, and implementing behavior change intervention, and 3.01, responsibility to clients. So again, these codes kind of have some areas where they could potentially conflict with the neurodiversity affirming movement. And so that includes creating client goals. That includes client goals are often are not representative of the norms of the client's culture. So, for example, forcing eye contact for clients whose cultures frown upon eye contact, that's a direct conflict. Effective treatment tends to be synonymous with neurotypical ideals and does not typically include neurodiverse behaviors such as stemming, echolalia, and scripting. So the neurodiversity affirming movement would kind of aim to manage or tame those behaviors, which is not client-centered. And so that would be a con. The involvement of stakeholders such as parents and caregivers typically overrides the desire input from the actual client, even when they can communicate their desires for goals and treatments. So a lot of time, treatment goals are made by parents or teachers or whatever the BCBA feels the child should work on, and usually the client is never asked what they want as far as goals for their treatment. Obtaining assent or assent withdrawal is rarely acknowledged in treatment that has been approved by parents or caregivers. So when the client either directly says they don't want to work on something or shows signs of not wanting to work on something, that is never acknowledged, and usually the client is pushed to continue working on the goal anyway. Refusing to complete certain tasks that can be seen as non-compliant, which can lead to punitive results instead of being viewed as withdrawing assent. So when that child does withdraw assent and are not compliant with what the BCBA or the therapist wants to work on, that child is deemed as non-compliant. Selecting, designing, and implementing behavior change interventions that extinguish unique characteristics of the individual and that the individual enjoys or that are not harmless to themselves or others. So, example, a child who has stimming that's not harmful to themselves or to others, but yet the neurotypical movement aims to kind of manage or minimize those behaviors. And finally, responsibility to client means analysts have a responsibility to act in the best interest of the client. Analysts can take that to mean creating goals to extinguish certain behaviors that are enjoyable or stress relieving for the client in order to make them more socially acceptable to others. Same example, trying to manage stimming and other behaviors that the client may find enjoyable or stress relieving.
All right, and then some key or main personal biases that we found related to this topic include a normalization bias, which is the assumption that making a neurodivergent individual be indistinguishable from neurotypical peers is more beneficial, long-term speaking, to the client. Um, However, I mean, this can lead to induced trauma, less effective therapy, and low self-esteem in the individual. Targeting insignificant symptoms of autism rather than focus on those meaningful and critical pivotal behaviors that target the overall quality of life for the client. Another bias is prioritizing compliance. There is a huge overgeneralization in the field that gaining compliance from a client is more important than assent, consent, and autonomy, which is a gray line. It can lead to coercion. You can be teaching them some learned helplessness and also suppress some of those self-advocacy skills, which are important and limited. Another bias is expert bias, which is the assumption that the practitioner or clinician knows more than stakeholders because of their expertise in the field. This can lead to discounting perspectives, unethical treatment, coercion, lack of responsiveness and humility, and also just informed consent. Um, Another bias is the deficit focused approach, which sees neurodiversity of individuals specifically as deficits and or problem behaviors, which leads straight to discounting the interests of the clients, their strengths, and pre-existing adaptive strategies. And then the last bias is overvaluing communication, which is another overgeneralization when implementing functional communication training, where practitioners only accept the modality of communication that is targeted for treatments. Um, this can misinterpret the client's abilities, can reduce the overall self-expression of individuals as well.
Okay, and now I will go over the dimensions of ABA towards neurodiversity affirming practices. The first one is applied. It targets socially meaningful goals that respect the client's identity and culture. An example of this is teaching adaptive skills that improve independence and self expression rather than enforcing eye contact or normal social behavior. This strengthens the therapeutic relationship and promotes autonomy. The second one is behavioral. It focuses on observable, objective actions while remaining sensitive to how terminology and labeling can influence perceptions. The example of this would be describing a behavior factually, like the student's hums during writing tasks instead of judgmentally. The student is being disruptive, helping reduce stigma and bias. Number 3 is analytic. It demonstrates that interventions are effective for that individual, not based on one size fits all model. An example of this would be the BCBA evaluates data to ensure that a strategy truly benefits the client, especially when cultural or educational contexts may affect how interventions work. Number 4 is technological. This uses clear, transparent procedures so everyone involved, including the client and family, understand and agree with the plan. An example of this would be the behavior plan. Behavior plans are written in plain, respectful language that avoids stigmatizing terminology and ensures collaboration. Number 5 is conceptually systematic. This connects all interventions to establish behavioral principles while aligning with values of dignity and respect. The example of this is using shaping and reinforcement principles to teach self-advocacy skills, showing how science and compassion can work together. Number 6 is effective. This measures success based on outcomes that improve the client's quality of life, not conformity. An example of this is a plan is considered effective if it helps a neurodivergent client feel more confident, communicate needs, or navigate their school environment successfully, even if their behaviors look different than peers. And number 7 is generality. This promotes lasting behavior change that works across setting and culture while recognizing that the neurodiversity pragmatism must continue to grow more inclusive. An example is a student who learns to request breaks in therapy also uses that skill at home and school, showing the intervention respects individuals' needs and supports real-world successes. Some of the core principal examples we found for neurodiversity affirming practices are listed below. I am going to touch on just a few of them. The first one is intersectionality. This is recognizing that people have different combinations of intersecting identities, which may result in different barriers and experiences. An example would be their finances, gender, race, sexual orientation, disability, co-occurring conditions. The next one that I'll touch on is validating differences, which is recognize and normalize different needs by offering options and accommodations as a matter of course, not something extra. Another one I'll touch on is promoting self-advocacy. This is respecting when someone tells you what they need or sets a boundary, modeling and teaching self-advocacy skills. And the last one I will read is the nurturing positive self-identity, creating a safe and supportive space for people to learn and grow.
So the next portion would we was asked to generate a few questions that parents or caregivers or professional may have or stakeholders may have about learning more on the topic. One of the first questions that was generated was what specific trainings / educations do the professionals require in order to adopt such practices efficiently? To adopt neurodiversity affirming practices, professionals will need education and development in disability and neurodiversity, ethics and bias awareness training, sensory and communication training, strength-based and trauma-informed instruction, modernized non-coercive ABA training, and ongoing CEUs guided by neurodivergent voices. The next question was asked, how can neurodiversity affirming practices be used to encourage inclusivity and appreciation of people of all kinds? Neurodiversity affirming practices encourage an inclusivity and appreciation by recognizing the difference as natural, reducing the stigma through respectful language, highlighting strengths and not deficits, challenging bias and stereotypes, providing accessibility and support, promoting autonomy and self-application, and creating an environment where people feel accepted. The next question was, what do you know about the potential issues that would arise in implementing of these practices, or what do you believe will be misconstrued by others? Some of the common issues when implementing neurodiversity affirming practices include misunderstanding them as no structure, resistance to update approaches, a lack of training, misinterpretation behaviors, um, concerns about accommodation, and concerns about accommodation. These challenges are usually the result of outdated mindsets and insufficient education and not the practice itself. Next question will be, what are the various varieties of neurodivergent affirming practices the behavior analysts can impose? Behavior analysts can impose neurodivergent affirming practices by respecting autonomy, supporting natural communication, honoring sensory needs, eliminating compliance only expectation, using strength-based methods, and prioritizing functional, meaningful goals. This practice center dignity, empowerment, and the individual difference rather than confirming to me. confirm I mean. How does the practice? The next question will be, how does the practices with varies with the establishment behavior practices that are employed. Neurodiversity affirming practices shifts from the model of compliance, normalization, and behavior reductions to one of autonomy, communication, sensory respect, and meaningful quality of life goals. The difference lies not in the tools of behavior analysis, but it also in how and why and from whom they are used. Neurodiversity affirming means treating people with different brains, the same way we treat people with different culture, personalities, and backgrounds, with understanding, kindness, and respect. The next question will be, how does the practice help individuals with autism, ADHD, and learning differences feel more accepted and valued? Neurodiversity affirming practices help people with autism, ADHD, and learning differences feel more accepted by their respective communication styles, supporting the sensory needs, celebrating their strengths, reducing the stigma, and allowing them to be themselves without any pressure to conform. Lastly, the last question we generated was, what are teachers and caregivers doing to help and honor neurodiverse children either at the school or at home? In my suggestion, teachers and caregivers honor the neurodiverse children by adapting environments, celebrating strengths, supporting communication, modeling empathy, encouraging autonomy, collaborating on support, and reducing stigmas. These practices help children feel respected, safe, and valued by both home and school.
Okay, and last up is our conclusion. One of the core messages we have is every brain works differently. Differences should be respected, not fixed. Some key benefits of neurodiversity affirming practices is that it builds trust between clients and professionals, reduces stigma toward neurodivergent individuals, and promotes long-term well-being and self-acceptance. Some ongoing challenges that are seen are cultural values may not always align with neurodiversity ideas. Language barriers or misuse of terms can cause a misunderstanding, and educational systems will struggle to include neurodiverse students effectively. And moving forward, we should aim for a balance between acceptance and effective support, ensure care is ethical, person-centered, and culturally responsive, listen to neurodivergent voices when shaping programs and policies, and build inclusive environments that celebrate diversity and help everyone reach their full potential. And here are a few of our references. right, and thank you. That is all.